you will find second year easy. Because most of the parts of the second year are similar to the thorax. Also, it looks a bit difficult. More difficult than upper and lower. Because of the big number of relations in the thorax. Because of the stereo, there are spaces. But thoracic wall, there are muscles, arterial supply. Sorry, blood supply. Blood supply means arterial supply and venous drainage. Lymphatic drainage. Muscles of the thoracic wall. Actually, I don't like muscles. But I like blood supply, nerve supply, lymphatic drainage of the thoracic wall. But I don't like muscles. But it may come in the exam. Lung. Relations of the lung. Bronchopulmonary segments and surface anatomy. Surface anatomy of the lung. Of course, mediastinum ده لو جات سؤال في mediastinum يبقى دي boundaries, subdivisions, enumerated contents in general. Thoracic wall, blood supply, nerve supply, lymphatics. Lung, relations, bronchopulmonary segments, surface anatomy, and recesses of the pleura. I prefer to know sites of constriction of the trachea. Relations of the trachea. Sites of constriction of the esophagus.
ترتيب النوتس الإعداد وتشوف الفهرس مكتوب فيه وتشوفهم تجيبهم بالترتيب كلهم العناوين
I would like to know the sinuses. Heart itself, surface anatomy of the heart and what? Different surfaces of the heart, sternocostal surface, diaphragmatic surface, posterior surface. I think that each surface of the heart you have to write. Number one, what are the chambers seen in this surface? Number two, what are the sulci seen on this surface? Number three, what are the arteries running on this surface? Number four, what are the veins running on this surface? Number five, relations of this surface. Each surface. فكرة في سبجكت انا لا اتنازل عن صفحة منه. امبريولوجي. نعم، احنا لسه قايلين كده، بيقول لك احنا لسه قايلين ان هو الاساس الاناتومي. انت ليك 10 درجات بس هم يدلوك على الباب. على فكره من غير امبريولوجي ما تقدرش تذاكر. لا مؤاخذه، على فكره هو جنرال امبريولوجي مش من الاهميه الكبرى زي السبيشال. General embryology is not that important as special, but the problem is that you cannot understand special embryology unless you know very well general embryology.
أبص كلهم قلبوا عليه.
اكتب اللي انا هقوله. ليه؟ على فكرة في الامبريولوجي يمكن يهمني قوي fertilization and implantation. fertilization ليه من الاسئله؟ ليه من الامتحان؟ الامتحان صعب. implantation, fertilization and implantation. يمكن implantation has great importance as regard ectopic pregnancy. And ectopic pregnancy means implantation outside the uterus. Okay? And placenta previa. Abnormal implantation inside the uterus. يبقى في abnormal implantation inside the uterus and abnormal implantation outside the uterus. I would like to know chorion and chorionic villi, which is the fetal component of the placenta. I would like to know intra-embryonic mesoderm. Placenta, umbilical cord, amnion, لو كلمته هقول رئيس الصفحة. twins. neural tube. على فكرة من غير الحاجات دي مش هتعرف تذاكر. اخوانا انتوا كنتم راضيين. Were you satisfied by the mid-year exam? Tell me about the most difficult question in the mid-year exam. لو واحد يرفع ايده. The final year exam will be exactly similar to mid-year exam. All what we need is for you to know anatomy in a good way. If it is in my hand, I will give a big mark for attendance. Just attending anatomy and listening to lecture and section in a good way is a very good part of your study. And if it's in my hand, I will make part of the anatomy exam open book exam. Because the exam was open. Answer وبعدين اديك سؤالين بس اوعى حد يعتمد على الوصفه. وصفه انه انه يتوصى عليه. مره حكايه انا يمكن حكيتها لكم في اول السنه، ما حكيتهاش؟ كان يا مكان ايه الحلاوه دي؟ الواد جاب القصه من اخرها. ابن مطرح استاذ زميلي حبيبي وشرط بيطلع الاول هي الثاني، انا قلت لكم الثاني في الاول. ايوه. ودخل عندي متوصي عليه، دخل عندي انا امتحن عند انكل مطر، مش انكل بس هو لا انكل. فالواد شاطر جدا، فقال لي انت واقف جنب الباب ليه؟ عشان تخرج اول ما خلصنا؟ انت ابو شعر طويل. طيب فقال لي بالنص كده اسحبني، انا مذاكر اناتومي زي الفل، انا عايزك تفحت. قلت له يا ابني لو ابوك اللي بيمتحنك هيفحت، انا ممكن اجيب لك صفحه انت عمرك ما شفتها في حياتك واسالك فيها. واديته مش سؤال، 3 اسئله، قلت له اللي تعرفه جاوب. فتح بقه، مش لو انت شفت اللواء، فتح بقه انت شفت الكرسي اللي وقعت عليه، وقال لي ما كله سهل. قال لي لا تسالني عادي خالص، زي مثلا لما اسالكم يعني ايه فنترال ودورسال. انا قلتها طبعا كتير، اللي يقول لي فنترال يعني امامي اقول له خلاص ما تسميها انتيرو بوستيريور، ويقول لي فنترال بتاع البهايم فنترال ودورسال. اما احد قال لي فنترال يعني قدام، قلت له هنا فنترال قدام، هنا فنترال قدام، هنا فنترال قدام، بس في اللور ليفت فنترال ورا. بصوا كده، بصوا كده، فليكشن هنا قدام، انما فليكشن هنا لورا. يبقى بمنتهى البساطه ventral is the surface toward which we flex, dorsal is the surface toward which we extend. لكن في transitional zone هنا، عشان كده بقول لك يعني ايه flexion؟ approximation of two ventral surfaces. يعني ايه extension؟ approximation of two dorsal surfaces. انتوا معايا؟ مرة سألت واحد البريكر بليكسس معمول بايه؟ قال لي roots T5, 6, 7, 8 and T1. They unite to form upper trunk, middle trunk, lower trunk. They redivide again into division. Why? 5 roots unite to form 3 trunk, then they divide into 6 division. هم ليه يدهموا؟ عشان يقسموا؟ عشان اخلط ايه يا حبيبي؟ عشان الدور طبخ ولا ايه؟ Why they divide again? ايه؟ المساحة ده اول كلابك، فبدل ما هم داخلين 3 دخلتهم 6 حشرتهم. يقول لك المساحة the area behind the clavicle is narrow. على فكرة area behind the clavicle is wide. Do you know why? Because the medial 2/3 of the clavicle are convex forward. Why? To make the apex of the axilla wide. When I ask you why the medial 2/3 of the clavicle are convex forward, to make the apex of the axilla wide. معايا؟ خلاص؟ علشان يتقسم انا I prefer the division anterior division or posterior division. No, I prefer ventral and dorsal. لأنه anterior division are ventral. They form cords and branches of the supply flexors. Posterior division are dorsal. They form the cord and the branches which supply the extensors. Supply the extensors. انتوا معايا؟ لو الواحد سألك فيها ممكن. اللي بقول ايه؟ مرة جون قال لك ال6 شهور اللي جاي the coming 6 months جون I'm going to train my arm. هشغل الارم بتاعه. انتوا معايا؟ فجاب لي بار حديد، مش بار حديد، ولعب بايسب ترايسب بايسب ترايسب بايسب ترايسب، وجاي بعد 6 شهور. Now show us your muscles after 6 months training. He's made like that. Biceps. Hey, watermelon, بطيخة. Then we ask him to show us triceps. Skin showing bone. Not triceps. Because he did it عشان ايه؟ عشان gravity. فعلا he was training biceps then training gravity. You train gravity. Then biceps, 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 biceps. هنا biceps by shortening. Isotonic concentric. But to go down slowly, it is biceps contracting. Lay to control the effect of gravity. To make the gravity will make sudden drop. Boom, boom. That you do. Boom. Going gradually, this means that you are controlling the effect of gravity by contraction of biceps, but the biceps become longer. The muscle can contract and get longer. And now isotonic eccentric. But isotonic concentric, the muscle gets shorter. It increases the power and the bulk of the muscle. Isotonic eccentric, the muscle gets longer, but it increases the muscle tone. Muscle tone. Can any one of you define what muscle tone? Don't say نعم العضلة. I don't want translation. What is muscle tone? What is muscle? يا ابني ما تخبيهاش، هي ما تعملش. What's muscle tone? Do you know muscle tone? يلا عشان ورايا معاك لازم اروح اسكندريه وارجع بعد ساعتين. ها؟ Contraction and relaxation. فلو يا جون, if you want to train triceps, what should you do? Get the bar behind his neck. Work triceps against gravity. Whatever you train your arm, triceps will not be trained unless you train it against gravity, against resistance, or by force. Look, Musmar, you are not going to use a hammer by gravity. You need even force more than gravity. يبقى اللي عايز يمرن triceps either work against gravity or by force. By the way, can you tell me a muscle you don't use in normal life in the lower limb? You cannot train it. Gluteus maximus. Gluteus maximus is a powerful. على فكرة أنا خلصت وقلت لكم على الإيه اللي أنتوا جايين علشان. خلاص؟ Gluteus maximus is a powerful extension of the head. Do you use gluteus maximus, an extension of the hip during walking? لازم وانت ماشي. Flexion, extension. بيقول احمد مش محتاج افرص. هو قال مش محتاج انطر. طبعا. Which muscle do you use during walking to extend the hip? Hamstrings. Hamstrings are weak extensors of the hip. اروح مع القانون. God creates muscles to act primarily on the joint distance. ربنا خلق العضلات عشان تعمل مختلط. Muscles of the gluteal region act on the hip. Muscles of the thigh act primarily on the knee. So muscles of the thigh, their powerful action will be applied to the knee. What if they act also the hip? Their action will be weak. Second. That's why hamstrings are powerful flexors of the knee, but weak extensors of the hip. But during walking, I'm not using gluteus maximus to extend the hip. Tell me if this sentence is iliotibial tract. You understand? Okay? It makes the iliotibial tract thin, converting the lower limb into rigid column to carry the body weight. Why there are two muscles inserted into the iliotibial tract? Tensor fasciae lata weak, gluteus maximus power. Do you need your lower limb to be a weak rigid column or a strong rigid column? Strong or weak? You need your lower limb to be more rigid on standing or on walking? Standing. Wrong answer. On standing. What if my body weight is 100? Each lower limb will be carrying only 50. So I need the lower limb to be rigid enough to support 50. But look, during walking in slow motion, carrying 100. If I need more rigid column during walking, but alternatingly. Yameen, shimal, yameen. So gluteus maximus is used during walking because it is a powerful tensor of iliotibial tract. It is powerful lateral rotator. Powerful extensor is used in standing from the sitting position, carrying the whole body weight, going upstairs, jumping. It's like triceps. You cannot train unless you sit and stand, or you go upstairs or jump. Okay? Muscles act primarily on the joint distance. Do you have muscle making this rule in the thigh? Adductors. Adductors do not act on the knee. They act on the hip. Although they are muscles of the thigh. They should act on the knee. They are breaking the rule. They act on the hip. That's why they are weak muscles. If you read about football players, they always suffer from tear in the adductors. Why? خارجين عن القانون. Outlook. They don't follow the rule. Which muscle in the arm corresponds to the adductor? Brachialis. It acts on the shoulder, in the arm, but it doesn't act on here. على فكرة, I would like you, when you study second year, first year, just preparing you for second. If you look to the clinical significance in the first year, you will find it minimal, except in the thorax. ماشي? But in the second year, every page you read can make you a doctor. Every page you read in the head and neck, in the abdomen, in the neuroanatomy, has clinical significance. Please, having excellent should not be your only target, but understanding and converting the knowledge from anatomy to medicine or surgery, you have to make use.